Hey everyone, today we're going to look at another technique that's a manipulation, high velocity, low amplitude thrust at the CT junction. And we want to be very careful and artistic with how we're going to do this. I've seen this technique done before, especially online recently, where they're putting patient's head and neck into more of an extreme position, side bending rotation, and they're really incorporating a lot of amplitude with their thrust. So for me, I want to be able to refine that a little bit more, and after thinking about it, I thought it'd be a good technique to demonstrate. So this is what we're going to do today. So for our patient right here, in terms of getting him set up for the technique, it's going to be a sitting technique, and what we're going to do is actually lock his upper and mid-lower cervical spine so that any kind of force that we use with our thrusting hand is not imparted through his head or neck. And certainly with our contacts, we're going to emphasize that as well. So what we're going to choose to do with locking is going to be something called craniovertebral locking, which I learned through NIOX with Earl Pettman. And in order to go through that locking, we're going to side bend him a little bit and continue to side bend him in increments down through the upper and mid-lower cervical spine until we've taken up all that available motion. So I just want to make sure that I have my contact on his spinous processes correct before I start that. So if you can come around this way and look at it from behind, what we're on is, this could be done at T2 also, but we're going to be on the right side of his spinous process here and using that to block from any movement occurring at that level. And then through our contacts above, we're going to be locked out from upper and mid-lower cervical spine from above. And then the technique that we're going to do, I'll show you with my hand position, is going to be a thrust with the lower hand on the vertebrae inferior. So whether that's T1 or whether that's T2 on the inferior segment, just depends on where your localization is. So you can back out just a little bit to see some more of what we're going to do. So I have that pressure there just for monitoring, and so I can bring him into side bending to the right, rotating to the left in gradual increments until I've taken up enough range so I feel like right there he's locked up through his upper, mid, and lower cervical spine. So he's going to stay there, and actually I'd have him positioned in a little bit more flexion, the way personal preference for me. And from here, my contact, the ulnar border of my other hand, is going to be on this upper segment. So in this case, it might be C7 or even T1, just depending. I'm going to be on the right side along the lamina of the upper segment here. When I do this, I get close to my patient and I bring them in toward me a little bit to help further localize and lock out. And when I go into this position, my thrusting hand is going to be a combination of this, where I'm pulling this lower segment toward me, and I'm further enhancing a little bit of side bending and rotating the opposite way with my upper hand. The thing I don't like to see with some people when they do this technique is they add a lot of traction through the head and neck, and their thrust is really with this upper hand doing a big amount of rotation through their neck. Whether they have them locked out or not, to me it's a very gross, in terms of amount of movement, large amplitude to sit here and not do anything with this hand and do a large amplitude thrust with this right one. And you see patients, you'll see therapists do this and then that to lock down, which is a much more large amount of movement for locking versus getting to where it's, relax for me there, getting to where it's a little bit more refined in terms of that, and then being able to get here and do a much more localized thrust. So here's what it would look like if I'm going to do it. Rotate down, right down to where I want to be. You okay there? Get my contacts right where I want them to be. I can even move around to make sure I get right where I want to. And then the technique is going to be one, like I said, of thrusting with my right hand here, and then my left hand in just a little bit of a counter thrust that way. So if we get to where we want to get, You're okay if we do that? Can you nod your chin just a touch? Good, and relax. Just to get right where I want to, and then that's the thrust. Here, like that. So we still get a cavitation, right? Cavitated. So we still get a cavitation. I'm much more specific and much safer with my choice of technique versus side bending, rotating to lock out, giving traction, and then doing a large amplitude rotary thrust with my upper hand. So that's just a little bit of ways of refinement. Certainly, which one felt more comfortable? So he's going to be biased because I'm shooting the video. But it's certainly a lot more comfort in terms of positioning and which hand is doing a large amount of force versus positioning, getting here, and then doing a quick movement like that. A lot less movement to occur from above and a lot less amplitude to occur for the thrust. So try it out if you're used to manipulation. If you're not, use it as a mobilization technique. If you're not comfortable with manipulation, use it as a mobilization technique. And then if you are comfortable, try it. But I certainly don't want to push this onto people that are either not trained well enough or aren't comfortable with it. This isn't for everyone. But try it out if you're used to it. Let me know what you think. Give us a comment below. And if anybody has any critique, please do so. I'd love to hear feedback. But yeah, let us know what you think, and then we'll keep posting more videos. And if you have any suggestions, let me know that too. Thank you.